Johnson & Johnson passing another major milestone, now just one step away from joining the nationwide vaccine rollout. A year into the pandemic, the end gradually coming into focus, the mental toll it's taken on many and how one local psychologist says we can overcome it. And the latest on the condition of Tiger Woods after a violent crash in LA left him with serious injuries. ABC 10 News at 11 starts now.
ABC 10 News at 11 starts now.
Great to see you this midday. I'm Jim Patton, and I'm joined remotely by my co-anchor Virginia Cha and 10 News meteorologist Megan Perry. Great to see you two as well, and we'll be with you very shortly. Well, this morning, Johnson & Johnson vaccine one step closer to being added to the list of vaccines to fight COVID-19. The FDA signaling it's poised to grant emergency use authorization. And as ABC 10 News reporter Marie Cornell tells us, the company says it's poised to start shipping doses.
U.S. regulators say Johnson & Johnson's COVID-19 vaccine is safe and effective. They applied for FDA approval last month, and it could be authorized for emergency use by the end of this week. The agency says the single-dose vaccine appears to be 85% effective at preventing severe illness, adding it also works against all variants and may even prevent asymptomatic infections. This adding to the global landscape of vaccines. Many are adopting Russia's Sputnik vaccine. While here in the U.S., both Pfizer and Moderna have already been granted emergency use approval by the FDA and are currently being given. Johnson & Johnson is under review, and Oxford, AstraZeneca, and Novavax are still being studied.
They're all effective. They will prevent you from dying from COVID or from getting hospitalized with COVID. I would get any of them whenever they're available to you.
An independent group of FDA advisors and a vaccines committee will meet Friday to make their recommendation about the Johnson & Johnson COVID-19 vaccine. If emergency use is authorized, the company says it's ready to deliver 20 million doses by the end of March.
We're prepared to ship immediately upon emergency use authorization nearly 4 million doses of our vaccine.
Right now, it's unclear how many of those could end up in San Diego County. Marie Cornell, ABC 10 News.
On top of that news, the FDA reportedly set to confirm data from Pfizer showing its vaccine can be stored at warmer temperatures than previously thought. Pfizer says it's found that its vaccine can be safely stored at around 13 degrees below zero rather than nearly 100. They say the change should allow more locations to store the vaccine, helping with local distribution. Virginia?
And as operations in San Diego start to get fully up and running again after last week's delays, a quick look at the rollout progress here. The latest county numbers show more than 500,000 people, 19% of San Diego's population, have received at least one shot. About 180,000 or 7% are fully vaccinated. Well, today, national pediatric groups are launching a campaign to push the government to tackle concerns about youth mental health issues, which are growing. So they say lawmakers need to provide more funding to existing programs and help fund new ones that expand children's access to mental health resources, such as telehealth and services at schools. They say the pandemic has exacerbated the issue, but that trends for things like hospital visits have been steadily increasing over the last 10 to 15 years. They are trying to raise awareness as well as government funding. Well, we have been on pandemic restrictions for nearly a year, and that includes stay-at-home orders, and the toll that has taken is showing. Part of our Rebound initiative is committed to helping you manage the pressures of the changes brought on by the pandemic. ABC 10 News reporter Cassie Carlisle spoke with a psychologist about the new stage many are now entering.
Up until this point, Dr. Michelle Carcel and other psychologists have taught us how to cope. Now she says we've hit a turning point and we need to focus on acceptance.
When we talk about acceptance, it doesn't mean that we are happy about it. I want to be very clear.
It's been a hard year of masks, loss, and closed doors. And Dr. Carcel says around the holidays, she noticed a big shift.
So for people who haven't had this experience before, or who are noticing really this isolation and early onset of anxiety and depression, it's taking more of a toll and they are reaching out more at this time.
Dr. Carcel says part of the issue is embedded in our history. We're pack animals and isolation makes you feel vulnerable.
What I've noted from a lot of people that are coming into my office that miss that connection, it really is just so hard, because just walking across the street or having someone, walk away from you can feel like rejection and can trigger so much stuff inside of us. So try to keep that in mind when you cross somebody, even at that 6-foot distance or more, that we can smile under the mask.
Saying a greeting goes a long way, and Dr. Carcel also said if you're having social anxiety, be kind and supportive of yourself and plan a small outdoor CDC safe picnic. Something like that could make a big difference. Reporting at home, Cassie Carlisle, ABC 10 News.
Renters who are struggling during this pandemic can now apply for help from the county. $100 million is available for emergency rent and utilities. To qualify, a person must be at risk of homelessness or housing instability, not receiving other forms of housing subsidies, and must earn less than 80% of the area's median income. Applications are on the county website. A rally is expected today to oppose plans to close the Brooks Street Pool in Oceanside. It's a controversial idea. The city says shutting it down could save them money, but residents and community leaders say the move appears racist. That's because the money saved could be put toward operating the new El Corazon Aquatic Center, which is miles away from Brooks Street in a more affluent neighborhood. Staff on the Parks and Rec Commission reportedly said there was money in the budget to operate both pools. The council will discuss the matter during tonight's meeting. The rally will be in the hours before that from 2:30 this afternoon until 5:30 p.m.
Now an update to a story we first told you about right here yesterday. Tiger Woods seriously injured in a violent car crash in the LA area. This morning he is in the hospital recovering from major surgery on his right leg. ABC's Zoreen Shaw has the details.
After an emergency surgery to golf legend Tiger Woods' right leg, his team saying he is currently awake, responsive, and recovering in his hospital room.
Person's trapped, vehicle off the side of the road.
Authorities say Woods' car flew off the road in a rollover accident around 7 Tuesday morning in an LA County suburb. ESPN reporting Woods was on his way to a golf TV shoot with quarterback Drew Brees.
No skid marks, no braking. So apparently the first contact was with the center median, and from there then cross into the opposing lane of traffic, hit the curb, hit a tree, and there was several rollovers during that process.
ABC's Matt Gutman was on the scene of the crash too and saw Woods' wrecked car. Emergency responders had to use an axe and pry bar to rip out the windshield to get Woods out.
See how mangled the car is pretty much from every side.
LA County Sheriff deputies say Woods appeared calm and lucid, and they didn't see any signs of impairment. Hours after being rushed to the hospital, doctors put a metal rod in his shin, which had multiple comminuted fractures. Bones shattered to splinters. Screws and pins are now stabilizing foot and ankle fractures. Another surgery was done for muscle swelling and pressure.
It's very fortunate that Mr. Woods was able to come out of this alive.
The chief says after the crash, Woods was trying to get himself out of the car, but he might not have realized just how bad his injuries were because he wasn't even able to stand up on his own. Zoreen Shaw, ABC News, Los Angeles.